to my channel. Good morning, good morning, good morning. I'm so happy you guys are back. So today I'm going to talk to you guys about diabetes to both cats and dogs. So without further ado, let's just get started and give you guys a rundown on what it is, how can it be managed, important things you need to know in the management and therapy of diabetes, what to look out for, and how you can assist your veterinarian in getting your animal to their perfect therapeutic insulin range, which is our goal. Disclaimer, this is by no means in place of your veterinarian. This information I'm giving you, do not self-diagnose your animal. I hate when my clients do that. They're on Google. Oh, my animal has this. No, Google has no DVM, baby. So let's just stay off of Google. Thank you. So this by no means is for you to self-diagnose your animal. You need to still take your animal to their regular veterinarian visits. This is just a tool and an additional amount of information that you can use with managing your animals. The first thing that I tell my patients when they're diagnosed with diabetes is that this is going to be something that you're going to have to be patient through. It's going to be something that you're going to treat forever, and that you need to know that we'll never completely get to our perfect glucose. We'll never get to what we were. All we can do is get to the point where we're managing at a therapeutic range to where we're not seeing any more clinical signs. And by clinical signs, I mean drinking excessively, urinating excessively, sometimes eating excessively, and losing large amounts of weight at the same time. What is the perfect dosage? And you guys have to work with the veterinarians because you're going home with them. You have to be compliant in giving the insulin at specific times. You have to be observant and watch their signs. You have to help us help them. So as a team together, your veterinarian and you and your pet will all be in perfect harmony. Okay, so without further ado, let's get into it. What is the therapeutic dose of your particular patient? Every patient is different. No one patient is the same. Some animals may be managed off 1 unit per day. Others may take 2. So some may be 1.5. We won't know unless we do the trial, and then you come back, get your spot glucose, and we say, okay, this is kind of being managed properly. It'll be something that's like a work in progress, and it's going to take a lot of patience. Type 1 usually tends to be the more predominant one, and that one is when you are insulin dependent completely, meaning you cannot uptake glucose on your own. Your cells cannot uptake glucose anymore on their own. Usually it's due to destruction of the pancreatic cells, the beta cells, which in our pancreas create insulin. Insulin helps us and allows us to be able to uptake glucose in our cells. And just to give you guys an idea of how important glucose is, everything in the body needs it. Brain being number 1 needs glucose, heart needs glucose, all of our cells need glucose. So if we can't uptake it, that's how we begin to run into some very serious issues. The goal is to eliminate the clinical signs. I don't want my patients to come in saying they're still drinking a lot, they're still urinating a lot, they're having accidents, and they're still losing weight. Going wrong if I'm just constantly losing weight. So I gotta figure out what's going on. So the very first thing your veterinarian will probably do is ask for a CBC Chem urinalysis. Those are 3 things that can help me kind of determine what's going on in my body. It helps me evaluate my organs, helps me evaluate what's going on in my blood, and it also helps me evaluate what am I getting rid of, meaning in my urinalysis, I'll be able to see if I'm getting rid of glucose, if I'm getting rid of protein, if I'm taking it properly, or if I'm not. So all I mean when I say that is your kidney's job to uptake 100% of glucose. You should never have extreme amounts of glucose in your urine. You shouldn't have extreme amount of protein in your urine. You shouldn't have extreme amount of white blood cells in your urine. I say all that to say, if we take a urinalysis and you have glucose in your urine, you couple that with high glucose in your blood, which will be told to me by CBC Chem, and then you also have clinical signs of diabetes, that is diagnostic and starting you on insulin. So when I say clinical signs, I mean, is your animal urinating a lot? Are they wetting the bed or having accidents in the house when they, didn't used to before? Are they drinking like copious amounts of water and you're like, what the heck is going on? And are they also losing weight? An animal that is losing weight really fast, that's one of my top kind of giveaways, that we need to do a CBC Chem UA to check for diabetes. And if it's not diabetes, it's something, because that's not normal for an animal to lose like 4 or 5 pounds in a month and it's still eating. Do you understand? The little middle ground that we like to have is just that the signs are eliminated. It'll always be what it is, diabetes. Do the CBC Chem UA, there's glucose in my blood, there's glucose in the urine. Now what? This is when you guys need to make it up in your minds and just put in your minds that this is going to be something that I'm going to have to manage for the duration of my pet's life. It's not something that's going to go away, and it's not something that's just going to ever return back to normal. When I say return back to normal, I mean that the glucose will never be spot on perfect ever again. This is because they have diabetes now. So as a veterinarian, what they will tell you is our job is to just manage the clinical signs. That's our job, to make sure our pet is getting enough insulin to where they're not going into a ketoacidotic shock, but we're also not giving too much to where our patient is hypoglycemic. And that's what we kind of call, what is our therapeutic range? What is the range in which my animal will have enough glucose in their body circulating to feed their brains, feed their hearts, without sending them into the extremes of diabetes, which is, like I said, from the opposite extreme is ketoacidosis, and that just means I don't have enough glucose. And then the other extreme is I'm hypoglycemic, which means I have no glucose at all because you gave me too much insulin, and now I'm going into shock, not giving too much insulin. And we're trying to prevent ketoacidosis by not giving any insulin at all. So we need to find the middle ground because we don't want to be on either side of the extremes. So in order for their cells to uptake glucose, this just means that they have to get insulin shots daily. If they don't, then they can get something called ketoacidosis, which basically just means that their body has gone into such a hypoglycemia that it's desperate. Your body is desperate. It's saying, look, I'll use whatever I can use. In this case, in our body's case, ketones is what our body will use when everything else, all other options are exhausted. Our body will use ketones. Like, okay, I need something. My brain needs something. My heart needs something. I guess I'll just use ketones. So the only thing about ketones is it's similar in structure to glucose. So our bodies can work off of it, but not for long because ketones are extremely acidic. So what you end up getting, that's why we call it a ketoacidosis, is because since the ketones are acidic, our body becomes acidic, and that's really not a good thing. So we want to avoid that and it getting that far. So if you start to see signs that you may think is diabetes, it's very important to take your patient in before you get this severe ketoacidosis, because that condition is life-threatening. But it's so this, let me just say this. This depends on the insulin type. At our clinic, we use something called Insulin. With that, we have to monitor. So you take your animal, we get the first initial glucose. My pet that I just had in last week had a glucose of about 600 in their bloodstream. That is bad. And like a glucose of 4 in their urine. Pretty much tells me I need insulin, doc. Duh. So basically I started her off at 1 because the way I am as a veterinarian, I always do the safest route. Safe means alive in my book, you know, keep them alive. So I always do the safest one first, and then I adjust accordingly. So I personally start on the low end of the insulin recommendation, and then I adjust it accordingly to how my patient is responding to the drugs. So I say all that to say, start the patient on 1. You get a glucose before you do that. Try to have them doing the same at the same times each day so you can kind of keep track. Some veterinarians will want to do something called a glucose curve, which is where they curve what the blood glucose is at each level in time during the day so they can see how you're being managed. Other vets, I don't know. Just know that some vets do a curve, so you may have to have them in all day so they can spot glucose after giving the insulin to see, okay, this is the nadir, or this is the lowest point, or this is the peak, or this is the highest point. Some vets will want to do that. So yes, so we start off at the lowest dose because I don't want to send my patient in a hypoglycemic shock. And then after we start with the lowest dose, they come back in about a week. I have my patients come back in a week, take another glucose after they've been on that regimen. You know, obviously timing is going to mean a lot too. If I gave my insulin at 1 o'clock and my patient is coming in at 6 or 7, you know, that's something to be accounted for, timing. So if your veterinarian tells you to stick to a certain time, stick to that time, because that means a lot when we're trying to evaluate if it's efficient, if our regimen is efficient. Come back, I'm going to do another spot glucose, and I'm going to see what their glucose is. If it's just close to 200, then I'm going to stop. That is my goal. If the owner says that signs have improved, and then if you know, I like the way my weight's going, I like how my blood glucose is looking, and I like that there's not much glucose in the urine, to me, that is what the animal will be on for the rest of their life. Now, it is important to continue to take this animal to the vet. A diabetic animal is going to have to get a little bit more TLC than a normal animal, so you guys are going to have to take them to the vet more than a regular animal to get refills on insulin, and the veterinarian may want to check to make sure everything's being managed properly. So again, pearls to go, what you guys need to know: constantly monitor your animal. Constantly monitor your animal. If something doesn't seem right, probably isn't right, call your vet. I always tell my patients, call me, call me, call me. Do not hesitate. I'm always here. So monitor your pet. The things that you want to look out for is seemingly losing a lot of weight. If they seem to be weak or have, like, some patients we see like bite a lot at their bodies, that's because sometimes they have what we call neuropathic pain. Or if you guys have cats, something they do is a plantigrade stance. It's where their hocks are like really flat. And that's kind of a dead giveaway that we have some nerve dysfunction due to the lack of glucose going on. Another thing to look out for, like I said, losing weight. And then the main ones: bedwetting, drinking a lot more water than what they're used to, eating a lot, but losing weight. Those are the main things that are going to tell us, okay, maybe we need to figure something out. Now, a ketoacidotic patient may have tremors, may have, seizures, may have, all the signs associated with, low blood glucose. So if an animal gets to that point where they're like recumbent or basically comatose, obviously that's something that you guys need to rush to the emergency room, because in that case they probably are in ketoacidotic shock, and that's what we don't want it to get. And you guys know that the clinical signs for having hypoglycemic shock are kind of similar. If they just don't seem to be doing right, laying down, being lazy, lethargic, depressed, tremors, that's something that needs to be taken to an emergency room. If your animal is being maintained on insulin, I really want you guys to look out for signs of, any type of tremors, seizures, or not doing right, because that means that if there is a short chance that we're not managing them properly with the insulin, like I said, they can either go into the hypoglycemic shock or the ketoacidosis, both in which are life-threatening. So take your animals to the vet if this happens. That's pretty much all the pros that I want to give you guys when you have an animal that you're managing with diabetes. Help your vet help you by watching out for clinical signs that may show that my animal's in trouble because it's not either having enough glucose or having just not having too much insulin and not enough glucose. You guys, we really want you to look out for that. Other than that, that's all I have to say about diabetes. I hope that this helped you guys with the management of your animals. Comment below to tell me if you guys thought that this video was informative. Again, I'm just trying to help out, so I'm always looking for ways to better myself. I'm always looking for ways to improve. So if you guys can, just comment and tell me if this is helping you or not, that would really mean a lot to me. I hope you guys have a great week. I hope you guys have a great day, and I'll see you guys in the next What Now. Hope you guys enjoy my pearls to go, and I hope you have a nice day. Bye.